surprised that I'm here. Probably not though. Y'all saw me do a best friend tag with her on this channel. So welcome back to RDH Encore. I'm gonna do a quick takeover. But today we're gonna sit down and just kind of ask Nikisha or Miss RDH Encore a few questions, and we'll see what we get out of this and get to learn a little more about her as well as the field of dental hygiene and what the complexities of it all is. And then from there we'll go from there and see what all we come up with. And so in just a few seconds you'll stop seeing just my face. She's gonna come on in. Hopefully we all together. We looking at different cameras. Got a nice little setup here. So basically what we're gonna do today is kind of like a question and answer thing for her channel. Basically, again, this is her channel and I just decided, hey, I'm gonna take over. So here we are.
She's been dying to take over for a long time.
Hey.
This is my best friend. I don't know if I introduced her last time whenever we did the Who Knows Me Best video. I'll tag that video. I actually put the information in the description box, just in case you want to watch it and get to know a little bit more about me. But this is kind of one of those videos, again, something that's different from the norm. And again, this is my best friend Dominique, and we've been friends for what, 14, 15 years since freshman year in college. So we've been through a lot together. She's my ride or die. So I guess without further ado, I'll go ahead and let her take over, like she's been dying to do so much.
But so what I'm gonna kind of just ask you about is dental hygiene. Who you are. How did we get here today? So just to kind of get started, what did you get your undergraduate degree at?
I went to Northwestern State University in Louisiana. You already know, that's where we met. We became friends the first day of work study job there, so second day of school. But yeah, I went there, and originally I wanted to become I wanted to be a dentist, I think, at first. Only because my dad was telling me that I should be my own boss, but ever since 7th grade I wanted to be a hygienist.
Okay, you mentioned the idea that you wanted to be a hygienist ever since 7th grade. Where did that passion come from at 7th grade? That's a really young age to kind of feel like you know what you want to do with your life.
Honestly, I feel like it came from nowhere but God. I did a career research program. I think it was an assignment or whatever in 7th grade where we had to, I guess, research what we wanted to be when we grow up, and then also outline the ways to get there.
Right.
So of course I wanted to go to Northwestern because, actually I think it may have been LSU at that point, but Northwestern is in the town that I'm from, which is Natchitoches, Louisiana.
You're trying to say you settled for Northwestern?
No, but honestly, I think I just said LSU.
Oh, my demons stand up.
That may have been the only school that I knew of, just because, I guess, Louisiana State University. But anyway, I actually really wanted to go to Northwestern because it was in my hometown. I got to go down and learn more about my roots and things like that. But anyway, I knew that I wanted to go to Northwestern. I knew that I wanted to become a hygienist. I came from nowhere but the Lord, I guess, because who wants to become a hygienist? I don't know. That's not something that a 7th grader thinks of. But I always knew that I was drawn to the field of dentistry. Every time I would go get my teeth cleaned or have any type of dental work done as a child, which was very minimal. I think it was mainly just cleanings. I would ask the hygienist all kinds of questions, ask the doctor all kinds of questions, be the annoying little kid with all the questions. So yeah, it just, I don't know, nothing but God.
So in becoming the idea that you started off at Northwestern, wanted to be a dentist, what changed the career path? Like while you were there, what did you ultimately get your degree in?
Okay, so I changed it a couple of times. So Northwestern didn't have a degree program for, I guess, going to dental school, pre-dental. I think they kind of named pre-dental and pre-med under the same thing, which was in essence a degree in biology. So I went on with the track of becoming or being a biology major with a minor in chemistry or something. And I think I finagled, I kind of changed the whole minor around a few times and different things like that. But I think maybe it was sophomore year, I just really started to think really long and hard about, okay, what if for some reason I don't get accepted into dental school like I really want to do, and do I really want to become a dentist? I started thinking long and hard about, okay, what if, have a plan B, so I'm like, okay, this degree of biology, what am I going to do with it if for some reason I don't get into dental school, or if that's not what I choose to do?
Okay.
And so I started to really become attracted with microbiology for some reason, bacteria, and just everything on a microcellular level, you know.
Okay.
And I don't know. So I thought about maybe changing to microbiology and just kind of going with that. Honestly, any degree in, I think, biology or any type of science would have been acceptable for dental school. But I really started thinking long and hard about, do I even want to go to dental school? And I kind of found myself, something just kept pulling me back and back to, it just kept pulling me into dental hygiene. And I didn't understand why. So, you know, after a while, I think junior year, I started kind of looking into, okay, I'm going to go to dental hygiene school after, because the program wasn't offered at Northwestern State for dental hygiene. So I decided to just, you know, I would spend countless amount of hours trying to figure out when I'm going to get out of school. I was going through, you know, a schedule for every single semester that I had left and determining, okay, how many semesters I have left and how many years in order to complete dental hygiene degree after that. So I, you know, really became focused on dental hygiene after that. So at that point, I just kind of wanted to get out of school. You know, I did want to learn about or continue on with a major that interests me, but I wanted to get something that was closer to the mouth, and so I went with nutrition with a minor in biology. So you know, with nutrition, I figured, you know, the things that you put in your body has a lot to do with the health of your mouth, and I wasn't wrong. So there you go.
So you know, ultimately that all worked out. So after Northwestern, did you find yourself in a period of trying to find a hygiene school, or did you go directly into dental hygiene at that time, like go directly into that, or was it like a period of, because most people, you know, when you fresh out of college, sometimes you go through a period of kind of what, like some people call like finding myself, or some people go backpacking, those that can't afford it, go backpacking through these countries, or just trying to figure out, what do I do at this point? Because I know in the year that we graduated college, there was a year that there was a downturn in the economy. So did you feel yourself faced with that challenge of the fear of, basically when you get out of college, you're kind of at the unknown. Mm-hmm. Did you feel like you felt that?
Well, I put so much planning into it, like I just talked about, so much planning. And, you know, they say the way to make God laugh is to tell him your plans. So, I mean, that's actually true. I don't know if he laughed at me. I'm sure he was there for me. But the thing about it is that I made so many plans and I felt so prepared. But when I graduated, it was like, okay, the economy, it just, you know, that was like 2008 or so. Yeah, 2008. And so I was forced to, I mean, I couldn't find a job in my career field, or I couldn't find a job in my major. And so I just pretty much whatever, the only thing that was out there when I moved back to Texas after school was basically, actually for the first year I ended up working at a, a medical supply store or something like that. What did I do? I did durable medical equipment for people who needed like hospital beds and CPAP machines and different things like that, and medical equipment. I tried to stick with that, and I was just like, I'm just gonna stay here and just whatever, ride it out, and I just forget about dental hygiene. Just because it was kind of depressing, because I mean, everything that I worked hard for and all the dreams that I had, it was, you know, just never happened. And so I didn't feel like it was going to happen. And so I ended up moving to Texas to be closer to my mom and my sisters, and moved here. And the only thing that was available was, work study jobs. No, what am I saying? The only thing that was available was call center jobs. And so I ended up working for a couple of call centers and things like that. And I was like, okay, I'm going to go to grad school. All of my friends are going to grad school. Let me just do that. And let me do something closer to the field of dentistry, because that's where I want to be. So I was like, okay, I'll just do public health with a concentration in dental. And I'm like, okay, after about a year of that, I'm like, okay, I'm still working a work study job, not really making very much, you know. I'm like, okay, what am I going to do with this public health master's degree, and I'm not even in the field of dentistry? Yeah. So anyway, I was like, okay, you know what? Stop spending your money and just go ahead and do what you want to do. So I decided to become a dental assistant, just to kind of have a feel for the program, have a feel for the field of dentistry. And so I did that for about 6 months, and then an opportunity came up for me to go to dental hygiene school, and the rest is history.
Okay. So great. Glad you got into your field. So once you got into dental hygiene school, what challenge Was it challenging at all for you, being that this is something that you've been passionate about since you were 7? Well, not 7, correction, 7th grade. Did your passion override
Okay.
the stress of it all?
Okay, I would say at times my passion did override the stress of it all. I was super excited. I felt like that's where I needed to be. That's where God put me. Because, you know, he was behind me throughout the whole thing. And he helped me to get there. And so I was like, okay, you know, this passion that I have and the fact that this is the will of God, then I'm going to be fine. But I mean, honestly, a lot of stuff with dental hygiene, such as like the clinical portion of it, I didn't find it easy at all. I didn't find it to be something that I was able to grasp right off. You know, the whole instrumentation thing. It was kind of hard for me.
More of a challenge because things typically would come easy to you as far as education, and normally, this became a challenge.
Yeah, normally for me, because a lot of my stuff had to do with like books type stuff, you know, and at this point it was more clinical and it was more hands-on, and so I actually had to grasp a skill, and it was kind of hard to do. Indirect vision, you know, it wasn't as hard as I thought, you know, being able to see things through a mirror, a little mouth mirror. But the whole thing of instrumentation and actually removing the deposit off of the teeth, you know, it's harder than what it looks like. So, but yeah, it was kind of devastating to me at first because I didn't grasp it as easily as I usually grasp things. I mean, I mostly made A's and B's, but with that, of course, in hygiene school, you can't make any less than a B. So I did do what I needed to do, but it just wasn't as easy.
So it was the practical portion of things that was the hardest part for you.
Yeah, and some of the stuff we had to go through, pharmacology, histology, just a lot of microbiology even was a little different in the dental hygiene field, different things like that.
So on those days where it was rough, like the book work, if I understood you correctly, you said the book work was the easier part.
Easier to a certain extent. It just depends on what subject it was.
Okay. So when it came to the practical part, when those days were more challenging, how did you overcome those days, or what gave you the push to kind of? And you mentioned that you're a different religious person or whatever. So beyond your focus of knowing that Jesus had your back throughout this, what was that extra push that said, you know what, don't give up, keep going?
I think it was my passion, honestly. I mean, like I said, I give all glory to God because he's the one that put me in that position. But I think it was the passion. You know, when things are hard, I mean, there was a lot of crying. I wasn't the only one, trust me. There was a lot of crying many days when I got home. But the thing that did the final push, I think, would be passion. That was passion with a mixture of Jesus, of course. But it was my passion for it. I mean, I had always wanted to be there, and I was finally there. So I had to make it do what it do.
Okay, Jamie Foxx. But outside of that, with having passion for that, now that you've been in the field a couple of years, do you feel that
7 years to be exact.
She unprofessional.
We have to take a pause for the cause, just a few minutes. I have to take my inhaler. Thank you.
So back to this whole idea that you are now a hygienist. How long have you been in the field now practicing?
I've been practicing, I guess next month, June would be since 2013. So 6 years. Yeah, 6 years.
Okay. So now that 6 years in, is the passion still there?
It's there. I think some weeks more than others. But it's just because life gets involved. You know, we're still living life amongst all of this. You know, even if those people who are able to do exactly what they want to do in life, which, I mean, that's what I wanted to do, you know, we still have our times, our weeks, our days, you know.
Right.
And it's just, you know, I just have to find my strength and move on, you know, and keep it pushing and provide the best care that I can for my patients, because this is where I wanted to be, and God help me.
So as a hygienist, now that you're in the field, you've gotten accustomed to the different areas, avenues, what do you find to be the most challenging about being a practicing hygienist?
Challenging.
Be honest. Let's be honest.
Some things are patience. Let's just be honest. Just because anytime you're dealing with the public, I mean, people have their personalities about themselves, and you know, sometimes you may not click with certain people, but you have to work a way around it in order to help them look at the bigger picture, you know, in order to actually provide the best health care to them. So I do what I can with that, with trying to kind of fit in with different personalities while remaining myself, just, you know, do my job. And
Well, let me just ask the hardcore question and get it right on out here for the public and the people that want to know. We live in a social climate where there's a lot of direct and indirect racism. Since being in the field, especially in the medical profession, is not a lot of brown and black people in those professions. Is that something that you feel that you've experienced, whether directly or indirectly, since being in the field?
Yeah, I experienced it a lot more whenever I first became a hygienist, and I think I just kind of had to get that tough skin about me. But yeah, unfortunately, I did. I mean, sometimes I think when I first started out, I started out temping for the first 6 months, which is great because I'm able to get a feel for the, for the field, how it really works outside of school, and kind of see where different offices, what they're like, and see where I fit in and where I want to be and what I want to do, that kind of thing. And so I mean, I would go to different offices on a daily basis or whatever, and I would call my patient back, and there's a certain look that certain people give me, and I can tell that it's just not because they're not used to they're not getting their normal hygienist. It's because because of the color of my skin, and not just that initial look, it's just the way that they treat you. They don't look at you in the eye, when you're speaking to them, and they're just short and just don't care. Don't get me wrong, it could be something else, but I've experienced it too many times to feel like it's anything different. But just like with anything else, regardless of the reason, they're just not respectful towards you as respectful as you are to them. So you just learn to put that aside and still provide them with the best care possible, because that's what you're there for. Do no harm.
And that's definitely because I personally don't feel that everybody is called into the medical profession. Personally, I'm not. My older sister, she's a nurse, and she's giving me stories, and I'm just like, y'all have to be called into that. And I personally am a strong believer in Jesus Christ, so I know there's certain things that he takes us all through and causes and sets us in for. So I commend you on being able to deal with the pressures. So what we were just talking about was the idea of everybody's not meant to be into the medical profession. So to kind of move along, again, at this point, can you still say that you enjoy being a hygienist?
I do. Like I said, I have my days, I have my weeks and things like that, but I just have to remember the fact that this is what I wanted and this is where God's put me. So I have to do my best in it, do it like I'm doing it for God, and then also just, do what I was supposed to help people. So that's what I need to do, and I need to treat every day like it's my last.
Cool.
So I try to keep that in mind, but it's not always easy.
Definitely not. We're all human. So we'll hit you with 2 more questions, and we're going to call it a wrap on the Dom takeover of RDH Encore. So my next question is, when it comes to younger generations that are coming behind you that want to get into this profession, what advice would you give them, like in just like a quick little sum up of what do you think would the most thing to prioritize into coming into the profession?
I would just make sure that they know that this is not easy. It's hard work. I'm sure you've heard that becoming a nurse is hard work, because that deals with the whole body. But dental hygiene, it's kind of like being a dental nurse in some sense, And so there's a lot there. You're not just learning how to clean teeth, even though that's what a lot of people reduce it to. You have to learn how to identify gum disease and different levels of it, and learn how to treat it. And you need to also know how to identify certain lesions. You can be identifying cancer in certain people, so this is a privilege that you're given, but it's something that you should not take lightly. And so it's important to make sure that you have the passion behind it, make sure that you're going to want to work for what you have, even on the hard days, and just continue to put people's health first versus how you feel that day. So very important. The passion will bring you through, but most importantly, just make sure that it's something that you want to do, and God's calling you to do.
And to kind of summarize it all up with the last thing, still focusing on the younger generation, because we always want to think about those that are coming behind us, because at some point they're going to have to take care of us. So you kind of want to try to give the best possible advice for those coming behind you. So now that you've gone through the idea of getting your bachelor's degree, started working on your master's degree, and then realized, hey, that's not the way I want to go. There's so many different avenues to get to different areas that we want to get to in our lives. at this point, because I've seen there's different technical or career colleges that offer different degrees. I've seen where they do offer the hygiene program at a technical college. For a student that's coming up, do you recommend them going and getting their bachelor's degree and then going into hygiene, or should they do a dual program, or should they go straight to a technical college where they're getting that hands-on experience from start? What do you feel about the dynamics of?
I just think you have to kind of determine for yourself. It doesn't really matter the way you get there. It's just, I mean, it depends on your life situation. Like, I had already gotten my bachelor's degree and part of my master's degree. And so whenever the opportunity came to go to a technical college, I jumped on it because it was a shorter program, because I already had the prerequisites that I needed. And it was a shorter amount of time. This way I'm able to kind of partially work while I'm in school, but not for the whole program. And so it fit my lifestyle better because we're going through a recession and everything else, and it was a godsend for me. And so I don't feel like, I know some people versus going to a regular university for the hygiene program, they think that, you know, they learn better, they learn more and things like that. But at the end of the day, we all have to take the same board exam, the same written exam, 8-hour exam regardless. And then also the hands-on exam, you have to take the same exact one. And so I think there's 3 of them out there depending on which regions you want to practice in, and we all have to take the exact one. It doesn't matter what school you went to. And so I got that pass grade, and so I'm good, you know. So at the end of the day, that's all you're looking for. You know, you do what's best for you as far as what education you get, but we're learning the same stuff because we have to pass the same board exam. And so all of us are equally qualified if we do pass.
All right, so that was one of the things that I kind of wanted. I was hoping that you would touch on the fact of ultimately you all still had to take the same exam, same work. So how you got to that point, it's on you, but don't be afraid to take a different avenue other than university. And I know that's something that's pushed on people, but it's not something that absolutely is necessary. It's a matter of if you can agree. It sounds like from the things that we discussed in the interview, your passion, your determination, and your willingness to have faith and know that, you know, you have someone behind you that's riding with you, that's pushing you to where you need to be, that's ultimately destined you to be in that spot. So I do appreciate you allowing me to do a quick takeover of your channel.
I appreciate
So
you.
anybody out there that has not just subscribed to the RDH Encore channel, do like this video, comment, subscribe, and come back for the next video that's coming. I'm not sure, how often do you post?
Once a month right now. Like I said, I've been going through some medical things, but I'm on the upswing now. And so I'll be posting once a month. I'll be getting back in there. I took a little bit of a sabbatical. But you can always enjoy my older videos. And I am coming up with a couple of new videos. So stay tuned for it. Hit the bell so that you'll be notified whenever those videos go up.
So all y'all other big partners that want to get with her, please do. So, you know, I'm the extra one, so I'm gonna ask for all the extra stuff. Colgate, Sonicare, Phillips, I think that's all the same. So she trying to rush me off the camera, but all y'all Crest, Listerine.
Well, that's all we have for today. So until next time, everyone take care and remember to let your smile shine. Bye.